here today just to explain to you why chiropractic for infants and babies and even children, and what's the supporting evidence for this and why one would bring their child or their infant to a chiropractor. And the reasons for that are really when a baby is born or an infant is born, that 80 to 100 pounds of pressure get put on that spine and that nervous system. And when the baby comes out, they don't have any muscle tone. So any parts of the spine can easily shift and move and put pressure on the nervous system or the spinal nerves themselves and wreak havoc on the development of the child later on in life. So oftentimes children come to our office, sometimes just to get checked after they've been born, knowing that that's very traumatic, or two, because they have symptoms or issues like torticollis or colicky baby or chronic ear infections, or had damage to specific things like their hips, and you can physically see that. And those are right after a baby is born that we check them, but also if you think about later on, as a baby starts to learn how to crawl and walk, they're falling and they fall off the table or the beds, or they're just trying to learn how to walk and they fall on their butt almost 1,300 times within a month of learning how to walk, and how important it is to make sure that that spine is in alignment and not putting pressure on any part of those spinal nerves or the spinal cord itself. Because for a baby to develop properly and neurologically, the spine and the nervous system needs to be intact and working at 100% or as close to 100% as possible. Hi there, this is Athens, and he has been a patient in the office for a little over 6 months now. We actually checked Athens as soon as he was born to see if there was any problems after birth, just to see if anything was out of alignment. And in fact, after 6 weeks, Athens developed an upper respiratory infection. And so we continued to work on his spine and his nervous system, relieving any pressure. And it's very delicate and very gentle, but after restoring his nervous system, he was able to heal, and he has not been sick since. So I'm going to demonstrate on what we check for first on babies, just to see how their spine's in alignment, and then I'm going to go ahead and do an adjustment on Athens. All right, are you ready, buddy? Awesome. So first I'm actually going to put him on his tummy. And we're just going to check right here on his butt to see if his hips are in alignment. So I'm just going to put light pressure here on both of his joints. And then I lift up one leg just to check to see if it's moving through the range of motion like it's supposed to. And see, he's still smiling. He's still doing okay. And then I'm going to check here on the left. And for him today, both of them are intact. But in order to adjust either of these, I would just simply put pressure on there a little bit more than I was when I was checking it, and then just push down and it slides right into place. And it puts everything intact and takes pressure off the nerves. And then I'm just going to move my fingers all the way up his spine. Still doing good, huh, Athens? Yes. And I'm just checking to see if I feel anything that's shifted left or right. And just like on his back, I just put a little bit of pressure with 2 fingers. Are you ready for this? Put a little bit of pressure with 2 fingers, and it pops right back into place. Awesome. So second check we're going to do, we're going to flip him over. Good, and kick his feet out. Awesome. And so we're going to look at his leg length and make sure that they're even after that adjustment. Perfect. And then we're going to check right up here on the upper part of his spine. So I'm just going to use 2 fingers to check to see if the spine's moving on both sides. And in any areas that I feel a little restriction and it's not moving, so I'll check his rotation to the right and check his rotation to the left. And see, it moves a little bit more to the left. So we're going to go ahead and adjust right up here at Atlas. And this is the area that we adjusted to activate his immune system. Oh, let's stay centered. When he had the chronic respiratory infection. And I just put a little bit of pressure, and it slides right into place. Good. You were such a good patient today. And then we can lift him up, and he's ready to conquer the world. Okay, so just like adults, babies have exercises too, and to maintain really good spinal health, we teach our mothers and fathers of their children how to hang their babies upside down. It's actually really effective in moving the spinal cord fluid that surrounds the spine and helps heal any areas that there was any compression from the spine being out of alignment, but also can just calm the baby if they're colicky or have problems. So we recommend this once a day, and typically children like it. So this is Athens again. Say hi, Athens. Yes. Okay, and we're just gonna take him and supporting his neck, we're gonna lay him on his back here. And then I'm gonna take him right below his ankles and just lift up. Are you ready? And you just lift up for 10 to 15 seconds. And typically they like it. And his head's gonna start to go red. And if they start to get stuck in one direction, it's also an indicator that they have a subluxation or pressure on their nerves. And then we can just gently swing and let him relax. Good job, buddy. And he is all set. He's done his baby exercises, and he's all ready to conquer the world. Hi, we just want to thank you for joining us today. Do you want to say thank you, Athens? Yes. For more information about the safety and efficacy of chiropractic for children, you can go to icpa4kids.org.